I'm going to go ahead and open this up to the public. But again, we won't start broadcasting until noon.
Good afternoon. Hello, and welcome to the January 2022 program sponsored by the League of Women Voters, Grand Traverse Area, and hosted by Traverse Area Community Media. Our topic today is health, the human face of the climate crisis. I am Ann Magoon, a League member, and I will be your moderator for today's program. The League of Women Voters is a national, nonpartisan organization. The League does not endorse or oppose any candidates or political parties, but we do obtain and distribute information to the public about candidates and their views. The League promotes the informed and active participation of all citizens in government. It works to increase the understanding of major public policy issues through education and advocacy. One of those major public policy issues is the global climate crisis. Membership in the League of Women Voters is open to women and men of all ages, and we offer a discount for students. Our program today is being shown on Spectrum Cable Channel 189, the Traverse Area Community Media Facebook page, and the League of Women Voters Grand Traverse Area Facebook page, as well as on Zoom. If you're watching this live on Facebook or Zoom, you can submit questions for our speaker during her presentation in the comment section on Facebook or in the Q&A on Zoom. We will have time for questions after the presentation. I'm happy to tell you that our speaker today is Dr. Elizabeth Lisa DelBuono. Lisa is a retired Traverse City physician who practiced for over 3 decades as a diagnostic pathologist. She is now the executive director of Michigan Clinicians for Climate Action, state liaison coordinator for Citizens Climate Lobby, and co-leader of CCL's Health Action Team. Lisa, please share with us what we need to know or what we should know about how our changing climate affects our health.
Thanks so much, Anne. I really appreciate being here, and I'm gonna just share my screen and get a PowerPoint up. I know that PowerPoints aren't always that much fun, but hopefully by doing that, whoop, that's not the PowerPoint. Can you guys see that? And just make sure, Anne, can you shake your head if you can see my PowerPoint, okay? Okay. But I think this will be interactive, and I hope we have a good opportunity to exchange some dialogue there. Please notice my email here. If any of this spurs some interest to you or you want to ask more questions, don't hesitate to reach out. So today we're going to talk about health being the human face of the climate crisis. But before we begin, I want to start by thanking the League of Women Voters, first of all, clearly for having me here today. I'm excited to be here, and I appreciate each of you coming to discuss what some people feel is somewhat a difficult topic. But I also want to thank the League for your years of commitment to what I think are the strongest foundations of democracy, which is a little bit fragile in our country right now. I think in order to have a healthy democracy, we have to educate, and I appreciate and have appreciated and listened to many of your educational webinars over the years, and appreciate that they're evidence-based and nonpartisan. So thank you for that. And I always go to your guide right before I get ready to vote. So huge thank you for all the work that you do. In starting today's presentation, I'm going to start with my father. He passed away a couple of years ago, but he was a World War II vet who, when he came home from the war, got his degree in mechanical engineering from using the GI Bill. And he had a growing family, so he needed that education, and we were lucky to receive it. And using his skills, he actually was pretty involved in the fossil fuel industry. He helped design some of the first pipelines that went through the Alps, as well as one of the first ones that went from Alaska down to the main 48. And, you know, as he didn't know at that time, and his generation didn't know at that time, that burning fossil fuels had this adverse side effect. It was producing a colorless, odorless gas that could literally change the health, the climate, the environment, such that it would be hard for life to exist on Earth. Now, fossil fuels have been wonderful for health, for producing drugs, for creating all sorts of infrastructure that lead to good things about health. But now that we understand this consequence of burning fossil fuels, we need to move forward to the next step and transition away from them. So CO2 and other greenhouse gases, but CO2 in particular, is one of the byproducts of burning fossil fuels. And the concentration of CO2 has actually increased exponentially since the beginning of the Industrial Revolution. And the importance of a greenhouse gas is that they provide a blanket, that's what the blue line over this picture represents, that traps sunlight as it reflects off the Earth in the form of infrared lights. It doesn't matter that they're infrared, but that warm the Earth. And without this blanket that warms the Earth, life on Earth would not exist. They're good things. But what has happened, unfortunately, that is that the concentration of these greenhouse gases, CO2, but other things like methane and nitrous oxide and water, have increased really, really quickly since that Industrial Revolution, like I showed you in the last slide. The blanket has gotten thicker, and the Earth is warming. It's trapping in the heat at a pace that's really hard to adapt to. And I think that this set of slides is really helpful to explain that. Scientists are able to go way up to the poles and pull out cores of ice that date back a long, long time in history, 800,000 years. And they have layers in them that are very, very similar to the rings in a tree. And the thicker the layer, the colder it is in any given year. And there are bubbles of air trapped in those layers. So they can measure the CO2 concentration at any specific time. So what these graphs show, and it may look complicated, is pretty simple. Below is temperature, above is CO2. And you can see that as CO2 goes up, temperature goes up, and as CO2 goes down, temperature goes down. There's clearly a correlation there. The other thing to notice is that if you look at the parts per million of CO2, basically the concentration of CO2, dating back all the way to 800,000 years, it ranged between 180 and 300 parts per million. So certainly it varied, and it does change over time, but it never went above 300 parts per million until when? The beginning of the Industrial Revolution. So when I was born, we were at 316 parts per million. A decade ago, I went the wrong direction. Let's go the right direction. A decade ago, when I first started taking action on climate change, we had hit 400 parts per million. Now that's the highest concentration of greenhouse gases that was ever seen on the earth since humans have walked on it. Now some people say, oh, it's been that high before, but that antedated life as we know it on earth. So it was 400 parts per million a decade ago when I started this. Now I want each of you to think of your favorite young person and imagine where they would be about 30 years from now. Imagine how old they would be. And let's look at where the greenhouse, what the concentration of CO2 is then. In just, this says 40 years, but it was a decade ago that it started, the dot was. So in 30 years, we're going to be at 600 parts per million. That is double the concentration of CO2 since humans have walked on Earth, and it has changed very, very quickly. So this change and this rate of change is the key thing that makes things so difficult for life on Earth to respond. It's just too hard to change, to adapt to these kinds of changes going at this rate. And that's true for polar bears, that's true for birds, that's true for essentially all living beings, including humans. And health is that interface. It's not the polar bear face, it's the human face of climate change. So that's going to be what we talk about. About 2 or 3 months ago, editors from over 200 medical journals told us, wrote editorials all at the same time, explaining that if we continue to burn fossil fuels as we are now, if we continue emissions as we are right now, and if our average global temperature gets above 1.5 degrees C, it will be catastrophic for human health. And these are very credible medical journals, including the New England Journal of Medicine. Now, the world's experts gathered together on a regular basis in a group called the Intergovernmental Panel on Climate Change, and they gave us a very clear prescription of what we need to do to stay under that 1.5 degrees C. Right now, we're at 1.1 degrees C. Think about all the climate impacts we're starting to see. We can be okay if we stay under 1.5, but we're on the path to 4.2 by the end of the decade. So that means our kids' life and our grandkids' life is essentially going to see that rate of change. And it's not possible to conceive what it would be like then. And even if all the countries were to meet the Paris agreements, we would only decrease that average global temperature by a single degree. So we are in a fight for our lives, quite literally. And in honor of Martin Luther King, he said it so well, we are truly confronted with the fierce urgency of now. It is all hands on deck. We are out of time. But the good news is Our Congress and our legislators are waking up to this, and it's terrific. The governor has issued a Michigan Healthy Climate Plan proposal. The first draft of that will come out this week, so keep your eyes open for that. Congress just last year passed a bipartisan infrastructure bill, which has all sorts billions and billions of dollars to start addressing the climate crisis. And there was very serious discussion during budget reconciliation of more robust policies that are currently on hold, but and could achieve staying under 1.5 degrees C. We can do it, but they're on hold right now. And to that extent, I would ask that you email the president, and Emily's dropping hopefully the links in the chat, and call your member of Congress, and there's links there. None of these links, these are through Citizens Climate Lobby, but it doesn't put you on their email list. You can choose to opt in only if you're interested, but it gives you the tools to make it very, very easy. It takes less than a minute to just ask them to take action on climate change. Now I'm gonna change gears a little bit, and I wanna do a poll because this is about health. So my question to you, and you'll see the poll come up in just a second, is what is the biggest killer worldwide? Is it climate change? Is that the biggest killer right now? Is it HIV/AIDS? Is it TB? Is it air pollution? Or is it malaria? Go ahead and start, finish filling out your polls. I'll give you a second to do that. Okay, I think we're there, so I'm going to end the poll, and I'm going to share the results, and I hope everybody can see this. You guys are really on the right track. Climate change is not right now the leading cause. It's a second. It's about, and the numbers really vary depending upon who you read and how they define a climate-related death, but it's at about 5 million a year. Air pollution is between 8 and 9 million worldwide a year. And interestingly enough, and I'm going to stop sharing, and I'm going to close out. I hope you guys were able to see that. Whereas everybody, and were you guys able to see that? Yeah.
Lisa, I'm sorry to interrupt, but could you read off the results for those on Facebook or on cable?
You know, can you do that now? Because I just closed out of it. I don't know how to get back.
Yep. So the results of the poll here on Zoom, 46% of respondents said that climate change was the cause that kills the most people worldwide annually. 38% said air pollution, 15% said malaria, and 0% said HIV/AIDS or tuberculosis.
Perfect. Thank you so much, Matt. Mm-hmm. So again, air pollution outdoes climate change right now, but both are big killers. And in fact, air pollution kills more people annually than TB, malaria, and AIDS combined. More than TB, malaria, and AIDS combined. And worldwide, fine particulate matter, which is one type of air pollution that we're going to discuss, is responsible for 1 in 5 premature deaths worldwide. So it is a huge killer. But if we transition away from fossil fuels, we can quickly improve health on that front like that. So I'm going to explain why. So when we're talking about the impacts of burning fossil fuels, I usually like to think of them in 2 categories. The immediate or direct impacts that come from pollutants that go into the air, but they fall out of the air quickly. Those are air pollution impacts, the fine particulate matter and ozone, and we'll talk a little more about that. The second group are long-lasting contaminants, greenhouse gases. Some of them are naturally occurring. CO2, methane, nitrous oxide, water vapor, those are naturally occurring, but the concentration is getting greater, and they will not fall out of the atmosphere. It will take decades for them to fall out. So let's start with the direct impacts of air pollution as a consequence of burning fossil fuels. So burning fossil fuels, even if you don't take climate change into account, is bad for our health. It is a type of secondhand smoke. And one type of pollutant is something called a fine particulate matter. It's just the little pieces that come off. They're so teeny, they're smaller than the cross-section of a hair, smaller than a grain of sand. They're very, very teeny. They're called PM, that's particulate matter 10 for 10 microns or smaller, 2.5 being the really more dangerous ones, and some are even smaller and more dangerous. The smaller they are, the more dangerous they are, because the bigger ones tend to lodge in your lung and you get respiratory problems, but the smaller ones can actually permeate into your vascular system and cause systemic illness. So they are more potent. So what kind of things are correlated with fine particulate matter? Well, worldwide, I told you 1 in 5 deaths are related to it. In the US, it's more in the range of 5 to 10% of US deaths. And there's a correlation between fine particulate matter, and I had not known this before studying it, and cognitive difficulties in the elderly. So people who are starting to struggle from dementia, it's not causative yet, but you're more likely to have a problem if you live in an area where there's a high concentration of fine particulate matter. There's an increase in incidence of preterm deliveries, low birth weight, and stillbirths in the newborn. And there's a study from Harvard that shows that there's an increased risk of dying from COVID. So if somebody becomes infected with COVID and they live in an area where there's significant air pollution, in particular high concentrations of fine particulate matter, they are more likely to die from the COVID. So that's fine particulate matter. The next one I want to talk about is ground level ozone. I'm not talking about stratospheric ozone, which is a good ozone that we don't want a hole in that protects us from UV light. I'm talking about ground level ozone that is a component of smoke and is directly related to asthma in many cases. Now, one important thing when we think about ground level ozone is that the concentration of that goes up as temperatures go up. So as we're having more and more warmer days, we're also going to have more and more poor air quality days. This is a graph from Detroit in particular, demonstrating poor air quality days and high ozone levels associated with temperature. Now, what happens when you breathe in ozone? Well, it's a lot like getting a sunburn in your lungs. And your lungs your airways are surrounded by muscle, and it doesn't like that. So they tend to contract, and that decreases the caliber or the diameter of the airway spaces, and it makes it harder to breathe. You also get a lot of snotty mucus in there. That's essentially what asthma is. It's a reaction to that injury. Now, there's many triggers that can cause asthma. It's not all fossil fuel related, but 2 of the big triggers is exhaust from our internal combustion engines and from the pollutants that come from particulate matter and high industry. Now, what population of people tends to live where this is greatest? Where are the interstates most dense? Where is the heavy industry most dense? It tends to be in the inner city areas, often where people of color reside. The incidence of asthma is epidemic now in the US, nearly 4,000 deaths per year. And just thinking about who struggles or is seeing air pollution, I want to do another poll. How many people do you think who live in the US live in counties in which the level of air pollution is dangerous, according to the American Lung Association? Would you say it's 10%, 20%, 30, 40, or 50%? Go ahead and pop your answer in there. Okay, we only have 17 of 24 of you who've responded, but I will tell you that right now, oh, I'm getting one more. I think some of you guys have listened to my presentation before because you guys have nailed it. It is 40% of people do. We have about, some people thought it was 10%, a little bit more thought 20%, a little bit more, 26% of people thought it was 30%, and about 16% thought it was 50%. So the correct answer is 40%, and that's what most of you thought it was. So I'm going to stop sharing now, and I'm going to close out. And I hope that you guys can still see can you still see the PowerPoint? Yeah, okay, good. So we'll move on. And let's see, it always takes a second to start back up. There we go. So the answer is 40%, and that's according to the American Lung Association, the most recent State of the Air report. What that report also showed is that 8 counties in Michigan, and they're not surprising counties, several on the west side of the state and several around Detroit, receive failing grades in terms of ozone in the latest State of the Air report. So that's important to notice. And then when we think about racial disparities, I think this is one of the core issues. People of color are 3 times more likely to breathe polluted air, again, according to the State of the Air report from the American Lung Association, than white people are. And if we go back and think about historically redlined areas, I would assume most of you are familiar with redlining that occurred in the 1930s. Low-income and minority communities were intentionally cut off from lending and investment systems through, they couldn't get mortgages through a system called redlining. And the red communities were the less desirable inner city communities. And then the outside, more peripheral communities, which tend to have more green space, et cetera, were the green communities. And you can see the areas that were historically redlined. This is in San Francisco, San Diego, and LA, but it's similar in essentially any city you look at. And then if you look at the number of ER visits associated with asthma, you see that it parallels almost identically. The red line areas are the areas where people are struggling the most with air pollution. Now, the good news about air pollution, if there's good news about air pollution, is that unlike greenhouse gases, air pollutants will fall out of the atmosphere very, very quickly. There's been several natural experiments, like in July of 2011, they closed a 10-mile stretch of this huge highway in LA for about 36 hours for repairs. And they were measuring air quality, and it improved within minutes. And that was for a radius of about 100 miles. And the number of ER visits due to asthma decreased over that same period of time. Similarly, in Atlanta during the Olympics, they found very similar findings, and they've seen that elsewhere. But why is that important? Well, that's important because if we were to electrify a transportation system and power those electric engines with non-carbon forms of energy, what would happen is we would see a great improvement in human health. We would save lives, and we would save hundreds of billions of healthcare dollars every year in the US. So that's a win-win. We are addressing the environment, we're addressing climate, we're improving human health at the same time. According to MIT, the healthcare costs that's associated with improved air quality alone can offset the cost of carbon cutting policies by up to 10 times. So that's the immediate health impacts of burning fossil fuels, but what about climate change? What about these longer lasting, natural occurring substances that the concentration has increased? Well, we're seeing the impacts right here in Michigan. I'm going to run through some of them real quickly, and then we'll dive in a little more deeply on a handful of them. The first one is it is harder for our farmers to grow the fruits and vegetables that we're so well known for up here in the UP. The weather is less predictable. It is more of a challenge. And back in 2014, Toledo actually could not drink their water because of a toxic algae bloom. Toxic algae blooms are occurring more and more frequently in the Great Lakes. We are seeing more and more extreme heat events, which I'll explain in a little more detail in a second. And we're finding that as the warmer and wetter seasons become longer, we are actually seeing longer allergy seasons. The actual concentration of the allergens on the weeds is greater. And in terms of ticks and mosquitoes, their range is getting broader. And for ticks, Lyme disease is a concern. For mosquitoes, it's West Nile. And the concentration of those, of the bacteria or the virus actually increases in the insects because of the warmer temperatures. I've gone over asthma and the fact that in warmer weather, you have poorer air quality. And we'll touch on mental health impacts as well. Now, this is a chart that comes from the CDC, and it basically says it's going to impact almost every aspect of human health. And one of the ways that I think is easiest to kind of frame it is that it often acts as a threat multiplier. It can take something that's a common medical illness and catapult it into a medical emergency. So to give you an example of that, this woman is a 70-year-old with a history of lung cancer. Now, lung cancer is probably not due to climate change. It may be related to air pollution, but it's not specifically due to climate change. And she was doing well at home on home oxygen for about a year. But her area had an extreme weather event, which we're having more and more in Michigan. And guess what? I don't think anybody would be surprised if I tell you that her power went out. So that's a problem for somebody with home oxygen because it's dependent on electricity. They often have portable oxygen tanks, but this woman, her portable oxygen tank ran out in the middle of the night and she ended up in the ER. So that's an example in which climate change can act as a threat multiplier. Let's talk about extreme heat for a second. If we continue burning fossil fuels as we are right now, Detroit is going to feel like the panhandle of Texas. No, thank you. By the end of this century. And heat kills, extreme heat kills. It's particularly hard on the elderly, the very young, pregnant women. Our young athletes frequently, a few of them often die because they're working out during the extreme heat and they're just not expecting it, but their systems can't tolerate it, even the young. But the people it hits hardest are the people who live in inner cities who can't get out of the heat. This is an estimate or a projection of the number of heat index days that are likely to occur by 2050 in Detroit in comparison to 2 a year in 2000. So you've gone from 2 in 2000 to 23, they project by 2050. So each of those days carry grave risk for illness and death, especially if you're in the inner city. And again, if you go back to those historically redlined communities, you see that these redlined inner city communities are also the ones, these blacker areas are the areas that have more concrete and hard surfaces that don't cool in the evening. So that's the urban heater island effect. In comparison to the green and blue, more desirable communities that tend to have more green spaces and will cool down in the evening. So the temperature disparity between inner city and outer and living outside can be very great and clearly relates to mortality or deaths that occur in extreme heat events. Water quality, let's take a quick look at that. And I think a lot of it is manifest in extreme weather events. So this is from NOAA. It's a little bit of a confusing chart, but it's basically looking at the number that's over here on the right of $1 billion events that have occurred in the US from 1980 to 2021. And this is the average number right here, that gray line. But all of these colored lines are essentially the most recent years, 2021, 2019, 2020. There's one outlier, 2011, but you can see that the numbers, even 2011, is above the average. The number of extreme weather events is greatly increasing. And in our area, it tends to be heavy precipitation events, lots of rain. And I'm sure I don't need to tell this audience, lots of rain, right? Poor Detroit, just every time they, got out of one of those flooding events, turned around and had another one, often associated with power outages, heat and humidity. And a lot of times that's the perfect setting for mold to develop if you can't clean it up quickly enough. And that has a huge impact on your respiratory system. This was Houghton on Father's Day a few years back. And this was Midland when the dams broke. And when did those dams break? Those dams broke right after the pandemic started, before there were vaccines, when we were in lockdown. Can you imagine having to leave your homes when you're in lockdown, no vaccines? That is an example of being a threat multiplier. And about the same time, our basement and a part of our first floor in Munson actually flooded. Not very good thing for, I actually don't know whether it impacted our masks and other kind of supplies or not, but you don't want it to do that. And flooding in hospital systems across the country is a well-known occurrence. Another thing that is probably a more subtle impact and a more frequent impact is the fact that our sewer systems in many, many places across the US are not designed in ways to handle this extreme water, especially if there's a combined sewer overflow system. And with that system, basically your sewage from your buildings comes out and normally will go right to your to be processed, no problem. But a lot of them are set up so that storm drains empty into those same drains. And when there's a big heavy rain event, what happens is they overflow the dam and they go out into the rivers and lakes. If you have separate sanitary overflow systems, that's less likely to happen. And when there's flooding, the other thing that happens is that you get contaminants from farms and the fertilizers in your parks and heavy industry in Midland, there was the risk of carcinogens getting into the water, et cetera. And all of these things increase our incidence of an exposure to bacteria. So think about Grand Traverse Bay. After almost any heavy rain, there's often an increased level of E. coli. And documented in many places is the fact that ER visits, particularly in children because they get out in the water, tends to increase because of developing some sort of infection after the flood. Usually it's a diarrheal infection. And then we'll look at environmental degradation. And in particular here, I want to touch on mental health impacts. One of the biggest mental health impacts, one that I personally suffer from, not uncommonly, is climate anxiety. When we think about the future, it gets very scary. And what I have genuinely found is that action is the antidote to despair. If this is a difficult subject for you, get involved. I strongly encourage you. Get involved with NEMIA, get involved with ways the League is getting involved in climate change. Join Citizens Climate Lobby, join other organizations, but get involved and do what you can. It's very mentally helpful. Obviously, too, with these extreme weather events, many, many people are developing weather events and wildfires out west, obviously, post-traumatic stress disorders. When people are forced in a minute to have to move their whole home. I had friends I grew up in Princeton, Kentucky, which was one of the towns that got devastated from the tornadoes in December. Seeing the Facebook posts on those are heartbreaking, and that's occurring across the country. And it's particularly hard on young children to adjust. Their schools are often impacted. Everybody that they rely on are now stressed and probably don't have the same reserve and time to help them. So these are long-term impacts that play out over time. In addition, the homeless, many of whom are mentally ill because we don't have the system set up to help the mentally ill as well as we should in the US. The homeless are particularly vulnerable to extreme weather events and food insecurity. And sometimes if a person is on medications for a mental illness, they become less effective in the extreme heat. And when it's hot, almost all people tend to become more agitated and sometimes even more violent. So that just scratches the surface of mental health experiences and really just scratches the surface of some of the health impacts we're starting to see today. But the key is to connect the dots. So I'd like to do another poll. And now that you're thinking about how really insidious it is and how ubiquitous health impacts of climate change actually are, I'd like you to answer, yes, I've experienced a climate impact. No, but somebody in my family has. No, but somebody close to me had a close call. No, but an acquaintance experienced a climate impact. Or I don't know anybody who's experienced a climate impact. I'd just be curious. Okay, about 80% of people have responded, and 20% of people said, yes, they have, actually 24% of people say, yes, they have experienced it. Another 24% said somebody else, not personally, but somebody else in the family has experienced it. Another 19, almost 20% says that they know somebody who's had a close call. And then another 10%, it's more distant. And about a quarter of people don't know anybody who's experienced a climate impact. And I really want to challenge people to think about it, because a lot of times when we think we haven't experienced a climate impact, it's because we haven't learned to connect the dots. And I think that's an important thing to do. So thank you so much for participating in that. And we'll see if we can get the PowerPoint going again here. And those were the questions. So I hope I've helped you feel like and understand that climate change is happening right now, today, here in Michigan. Now, the question is, what do we do about the problem? Because we can do things about the problem. And the medical community has really taken off in terms of this. In 2017, an organization called the Medical Society Consortium on Climate and Health formed. It consists of 32, and I think that number is even harder, medical societies all calling for urgent action on climate change. This includes the American Medical Association, but it also includes our internists, our family practitioners, our pediatricians, our OB-GYNs, allergists, ER docs, etc. So the medical community is waking up to this. And the organization that I and Julie Quinn founded a couple years ago, right as the pandemic started, is Michigan Clinicians for Climate Action. And we are one of 22 state affiliates to that consortium. And our goal is to educate, empower, and engage other health professionals, the general public, and policymakers on these issues. So the Lancet Commission, which is a very reputable British journal, calls the climate change the greatest public health threat of the 21st century. Now that's a heck of a statement in the middle of a pandemic, but clearly we're facing an existential threat. The good news is this, though, it's also a tremendous public health opportunity. And why would you say that? Well, you say it because much of what we do to address the climate crisis is also good for our health. Whether we're talking about more active transportation and creating an infrastructure that makes it easy to walk or bike to work or play, eating less meat, driving electric vehicles, or not idling our cars. These are great individual actions that we can take, but in order to really see emissions come down, we need policies in place that make the easy choice, the healthy choice, and the environmentally friendly choice. So we need collective action, just like the pandemic. So what does good, effective climate policies look like? Well, from a health professional's point of view, you want it to improve human health, reduce emissions at a pace to get us under that 1.5 degrees C. It should clean up the air, and it should protect the most vulnerable while reducing emissions, and hopefully not be too difficult to implement. So regenerative ag is a good place to start. Anything that can be done to improve the quality of the soil that will sequester carbon, produce more nutritious products, more nutritious food, and it'll help with the runoff. It can absorb extreme weather events more easily, and the water from that, etc. And there is a bill that's gone through the Senate in a bipartisan way called the Growing Climate Solutions Act, and it's working its way through the House. This is not an area I know a tremendous amount about, but Emily is dropping in the chat a link to a speaker that we have for the MICA on February 25th. That's going to go into ag, health, and climate in detail, and you're welcome to join us. You can just email one of the two of us and we'll send you the Zoom link. So our ag system is one thing we can do. Electrifying our transportation system is key. It improves outdoor air quality, especially if what's powering the batteries is clean, renewable energy. And to bring this home, I just want to show you a couple quick graphs. These come from a global climate simulator called MIT En-ROADS. And this is basically our energy mix on our left, and on the right is the average global temperature increase based on greenhouse gas effects. And we can simulate what would happen if we electrify a transportation system. Now let's look at it if we don't do anything with our energy mix. What would happen? What we see is if we don't change our energy mix, we can lower emissions such that we decrease the temperature by 0.1. But what happens if we change this energy mix and we switch over to renewables? Then we can get down to 2.8 degrees C. So we need to do both of those things. We also need to electrify and improve energy efficiency of our buildings and home. That improves indoor air quality. We need to get away from natural gas in our homes. And again, I'm going to show you one of these graphs to kind of bring home the point. Now, this is essentially we've transitioned over renewables. We've changed our energy mix. Now, I want you to keep your eyes right here and look what happens if we electrify and improve energy efficiency of our buildings and transportation system. Look at this graph and see what happens. Boom. We don't need nearly as much energy if we improve energy efficiency and electrification. We need to improve our smart grid so that intermittency issues are addressed. That can happen by a more distributed smart grid so that we can get energy that's been stored and effectively into our homes when the sun isn't shining or the wind doesn't blow. And ultimately, we need to transition away from dirty fossil fuels. I explained why it's unhealthy for us. It minimizes the worst impacts of climate change if we do this transition, but we get immediate health benefits. And the key to catalyzing this transition is a price on carbon. It acts as a booster shot. It won't solve all the problems, but it's a necessary first step, because it's essentially turning off the faucet in the overflowing bathtub. It's stopping what's coming in. It amplifies the effects of other complementary policies like electrification and energy efficiency. It spurs innovation, so there's incentives to develop that smart grid and energy storage. And it takes a huge chunk out of air pollution and emissions. So it improves health and protects the most vulnerable. And one more graph to bring this home. This is what it looks like if we have energy efficiency and electrification without a price on carbon. Again, we're at 2.4 degrees. It's pretty good. Add a carbon price in there, and now we're down to 2.1 degrees. So it essentially amplifies the effectiveness of other policies. Rounding out, thinking about League of Women Voters, Citizens Climate Lobby, where I'm a state coordinator, says that a solution to climate change is democracy, and we need you on our team more than ever. So I would ask you to consider doing a couple things. First and foremost, Catherine Hayhoe always brings this point home. Talk about climate change. Start connecting the dots for yourself and for the people around you. That will really help. Emphasize that it's a public health crisis, and that by addressing climate change, we're actually improving health. Climate solutions are health solutions. Consider again emailing President Biden or calling our members of Congress. Emily will drop those in the chat. And then here are a couple of things that I would like the League to think about, either locally or expanding it upward towards your the rest of your League, your partner organizations. Think about educating your volunteers and your voters that a vote for climate is a vote for health. You don't have to tell them who to vote for, but that climate change is important when you're evaluating your candidates. And encourage them to, when they go to candidate forums, to ask them, what is their climate plan? If we are universally asking all of our policymakers, what is your climate plan? It will become important to them to develop one. Encourage people to vote. That you guys do that. But there's a couple really cool groups that you may not be aware of. One, the League is a partner with. It's called Vote ER, and it gives health professionals the tool to register patients right in the ER or in the clinic. It doesn't have to be when you're getting your driver's license. And there are very cool techniques that make it very easy for people to do while they're waiting to be seen by their doctors. It was started by this brilliant guy in Harvard. It's being pushed out across the country. League of Women Voters are partners with that. I'd love to see that happen in Michigan, but we need people who have the energy and the expertise to push it out. Again, all nonpartisan. And then the Environmental Voters Project is another one that simply gives reminders to people to get out and vote. And they tend to try to hit people who are environmentally conscious. So we can do this, and I'd like to open it up for questions from other people.
Great, Lisa. Thank you so much for that wonderful presentation. There was so much information there. I'll only be able to hold some of it in my little brain here, but I do intend to be able to go back and refer to it because it will stay on the League of Women Voters Facebook page. It might end up with a YouTube or something like that, but anybody who wants to can go back and review that later. I do urge any of our viewers who have questions about anything that Lisa has talked about or other questions related to this issue of climate change and health to, if you're watching on Zoom or one of the Facebook pages, please use the Q&A, or on Facebook, use the comment section to submit your questions, and we'll try to pick up on them. But I have one to begin with, and that is about, we'll just say Michigan. It could be more local, or if you want to talk about the United States, in terms of health issues that you have seen directly in your experience, either as a physician before you retired or currently. What types of things are you seeing that maybe that helped bring this to your attention as a big issue?
Well, personally, I did not see a lot because, first of all, I started, my position is very far removed from the patient. I did see lung cancer very commonly. Cigarette smoking is the #1 cause for that, but certainly air pollutants can contribute to that. I got involved in climate action, mostly recognizing that it would affect my son. Now, what things are other people seeing? Well, I hope I covered a lot of those. Increased incidence of allergies and asthma, all over the place. I mean, I would guess almost everybody would say that they're seeing more allergies. Certainly, another example are ticks. I would guess almost everybody has noticed that ticks are more involved in the incidence of Lyme disease, and ticks carrying Lyme has increased. And that's right here in Michigan, and then the impacts of extreme weather events, which I commented on before. There was a period of time here in Michigan, but really across the entire country, that it was hard to get saline. That as part of a lot of medications and IV fluids, there was a real shortage. And I was practicing when this happened, and I remember the pharmacy commenting on it, and we saw it across the country. And why was that? It was because of Hurricane Maria in Puerto Rico, totally knocked out our supply chain, and that they supplied those fluids across the entire country. The New York Times, which I could send to you guys if you want, beautiful op-ed of the director of the emergency room talking about what it's like to evacuate people while fires were literally outside, licking the flames. One of his ER doctors on the phone with his family, I am evacuating, I can't stay in our home. I personally have had, my sister had to evacuate twice. Her husband has dementia. She can't drive at night. It's horrific, and it's affecting people across the world. So I hope that gives you an example. But for here, it's the floods, the asthma, the allergies, the extreme weather events, and the ticks and the fleas and the water.
Right.
Not fleas, mosquitoes.
We have another question. Does the Environmental Voters Project have any members or chapters in Michigan?
I don't think it's organized that way. I think it's organized with, there are volunteers from Michigan, and what they typically do is, thank you, Jan, is they identify states that have harder voter turnout, and then they empower their volunteers to do these reminders to people to get out and vote. So one of their policies, what they say is that members of Congress, and really not just members of Congress, all policymakers, all elected officials, care about what voters are saying much more than population polls. They want to know what the voters are saying. So the key to really being able to influence what's being discussed is to get people who care about this issue voting. And they need to be voting at all of their elections. They're local, all the way up and down the ballot, every single local initiative, because then they're identified as a voter and someone who's concerned. So what happens is, I'll get a little text once you sign up, you'll get this little text and it says, Lisa, you have an election coming up. And I'm like, oh, shoot, I do. And I tend to go to League of Women Voters to find out, well, where is it? What am I voting on? But it gives you that little flag up to say, pay attention. And I think that really complements the work that you guys are doing. Okay,
great. Thank you. We have another question, and this one might take a whole presentation in itself. So I'm going to ask you to try to streamline an answer, but I think it's a great question. Can you explain carbon fee and dividend?
I can. Okay, so carbon fee and dividend is one type of carbon pricing. And it consists of actually what we call a three-legged stool. But the most important thing is to start, I don't know if it's the most important thing, but one thing to think about is we're talking about a carbon fee or tax, and it's occurring on fossil fuel companies, not on individuals. So it happens way upstream and it affects the entire economy. That's why it's different than a gas tax. It's just on the people when they're filling up their gas tank. This is on the fossil fuel companies, way upstream. So it affects everything in the economy. It starts low, it goes up every single year until it creates a point at which you have essentially priced fossil fuels out of the market. Now, that's very different than a cap and trade. Cap and trade does the opposite. It sets a cap and it goes down and down and down. The key thing with cap and trade is that you can trade permits between polluters, and it ends up like a game of whack-a-mole and tends to be less effective. Often there are places where pollution can reside, where fossil fuel companies are purchasing offsets, maybe in some far off, maybe in Indonesia, they're buying trees and not really reducing their own emissions. So that's the struggle with cap and trade. This is not that. This is a carbon fee. Every single fossil fuel producer as far upstream when it comes out of the ground and into the country would be affected similarly. Nobody can get out of it. And it forces that transition to clean forms of energy. That's the fee. The other part of it is we know that people who, we don't want to hurt people who are struggling to put gas in their car, heat their homes, the most economically challenged. And there have been studies from all over the place, from Columbia University, Resources from the Future, Office of Tax Analysis, et cetera, that says if you take even just 70% of those dividends and return them back to households, you can protect and in fact, give more money back to the people who are struggling than the cost of living would increase. So you can offset those costs. It's not going to make anybody rich, but it lessens the impact for those who are really struggling. So that's a carbon fee, and that's the dividend. There's another key part that I'll go real quick with, and that is something called a border adjustment. And that's really important because it basically says if there's a carbon fee here or a carbon price here in the US, any country that we're doing business with has to put on an equivalent price in their country, or else they get charged something at the border. And so what it does is it creates an incentive so that if the US puts a price on carbon, it creates an incentive for other countries to follow suit. And guess what? Europe and Canada have beat us to the punch. They have prices on the carbon right now. It's projected to go up to about $100 per ton, I think, by the end of the decade, and they're starting a border adjustment. So our businesses are going to be in a cruddy position if we don't get that carbon price on. Plus, if I've showed you that En-ROADS, and Emily put some things in there about how to check out the En-ROADS. If you check out some of those modeling, it will reduce emissions more quickly than the other tools. Now, that doesn't mean we don't need all of the tools. We need all of them. We need regulations, we need the fee, we need all sorts of complementary efforts. But it's a really effective tool. Hope that explained it. Hope I didn't get too long-winded.
No, that's great. Thank you very much. Another question. You are the executive director of Michigan Clinicians for Climate Action. Is there an organization like that in every other state, or?
That's a good question. And Emily, I think, can you put in the chat, please, our Facebook and our website and all that kind of stuff if you haven't already. So right now, this is an affiliate of the Medical Society Consortium, which is a national group organization, again, of those medical societies I showed you. It's housed in George Mason University. There are, I think, 22, it keeps growing, so it might be a little bit larger than that, state affiliates at this point. It started in 2017, and you just have to find somebody who's willing to take it and run with it. So they had been asking for a while, and when the pandemic hit, I decided it was a good time for me to make the transition. And we had a core of health professionals who were interesting. I do want to emphasize, It is not just for physicians. It is for nurses, physicians' assistants, and counselors, and anywhere in the health, community, public health officials, et cetera. It's not exclusive to physicians.
Now, do you know of any medical related or health related associations or organizations that are opposed to or don't believe in, if that's the right word, the effects of climate change on health and say that's a waste of time?
That's a great question. I'm so glad that somebody asked that question. And what I would say is that I think overwhelmingly most health care systems like hospitals and that sort of thing, and most health professionals, unfortunately, this is not on their radar. It hasn't been taught in medical schools. It hasn't been taught in nursing schools. One of the big things that MICA has done is we are doing a lot of work with like U of M and several other medical schools and nursing schools. And I know they're doing that in the other state affiliates to try to get it part of the curriculum. But it has gone for the medical community until very recently. So I think if you were to ask individual doctors, there would be a lot of individual doctors who would say, no way, or what are you talking about, or isn't this crazy? But as really reputable journals like the New England Journal of Medicine and Lancet have whole sections dedicated to climate change, it is becoming less and less refutable, and there's more and more evidence-based literature out there demonstrating the impacts. So I think it's simply a matter of making people aware, and the pandemic has made it way harder for healthcare systems and for individuals to just come up for air to even try to assimilate some of this stuff. The last thing I would say is there's a really wonderful organization called Healthcare Without Harm. And what it does is it says, okay, if we're a health professional, we should not be spewing things into our environment that is making our patients sick, but we are. In fact, if you look at healthcare, if healthcare in globally were a country, if it were a country, it would be the 5th biggest emitter of greenhouse gases. If the US healthcare system were a country, it would be the 13th largest emitter of greenhouse gases. Some of that is related to the fact that anesthetics are really potent greenhouse gases, like thousands of times more than CO2. So some very simple education, thank you, Emily, for that. Simple education can really have a huge impact in healthcare systems. That's something I would love to get some health professionals in Michigan excited about. Spectrum has really done some great things. We were invited to talk to the Michigan Hospital Association on this, but we would love to get like a group of very dedicated people who are looking at this issue within healthcare. Again, more than you wanted to know, sorry.
Wow, no, there's another whole talk on anesthetics and the science behind that. Okay, a question about what does Citizens Climate Action actually do? Is it a membership organization? Do you have to pay to join? I know one thing that they do apparently is have people like you give wonderful talks, but what else does CCL do?
Yeah, so Emily, I'm going to have you put the link for Citizens Climate Lobby in there. You can just, the major organization, and it's CCL, and it's got a terrible name. I've said from the very beginning, to call it a lobby is not a good thing. It's citizens advocacy. Nobody's paying us to do anything. What it is it's totally grassroots. We have over 200,000 supporters in the US. We have chapters all across the world. We're actively involved in the COP meetings and getting citizens involved in those. So the international meetings that occur on every year. But in addition, at home, we have chapters in essentially almost every voting district, I think 500 chapters in the US. And basically what it does is it gives you the skills as a citizen to engage with your members of Congress and with the public and with community leaders in ways to affect climate advocacy. And so it teaches people how to do presentations. I never did presentations prior to this. It has all the tools to teach you how to do that. It teaches you how, but you don't have to do presentations, and the vast majority of people do not. It gives you tools to write emails. It gives you tools to call your local member of Congress. It teaches you, if you're interested, but you don't have to, how to write letters to the editor or op-eds. And it does it in a fully nonpartisan way. So we say we welcome everybody. You can, as long as you take climate change seriously, that would be the one prerequisite. So if you're a doubter, or if you're a doubter, you could probably join, and we would try to bring you along. But if you really strongly don't believe in climate change, then it's probably not the organization for you. We meet every month, but it's really almost everything can be done from home. And we usually always take time to meet with people as an individual. We do this for both MICA and CCL, but I learned it from CCL. We meet and we encourage people to do things that resonate for them, what they feel comfortable doing. So if you're an artist, we'll strongly encourage you to maybe engage with your artistry community and find ways to get it out to that community. If you have a strong faith perspective, then we encourage you to use that as a tool. And the last thing I'll say is that there's tremendous support from the CCL National, all sorts of webinars you can get online to teach you how to do these things. But in addition, there are things called action teams. So if you're from the UU Church, if you're from the Presbyterian Church, if you're very involved in environmental justice issues, if you're a person of color, if you're a health professional, then there are these action teams that bring those groups of people from across the country to also meet and educate and work through those.
That's very interesting and very wide-ranging. As you know, the League is very involved, of course, with advocacy as well as election and information. And it's so important to let our candidates know what our concerns are. It's surprising how effective we can be if we just, as voters, as you said, the candidates are really listening to their voters. And we need to make that clear.
It's so true, Anne. And one thing I would add with that, one of our key things and why we're organized according to voting districts is our executive director used to say we bet the farm on relationships. So we try very hard to develop a relationship with all of our members of Congress. Sometimes it's more challenging than others. Honestly, after January 6th, it was very difficult for a lot of us. But we still try to engage respectfully and in a nonpartisan way and as generously as we can, believing that in the core of these people is a desire to do right. And so we try to develop that relationship over time so that they see us as trusting resources. And we find that because of that, we've almost every policy that we've advocated on, and people think we've only advocated on carbon pricing, but we've advocated on quite a few others. Almost all of them have passed Congress one way or another. And, there's serious discussion among the Senate about putting a price on carbon as part of budget reconciliation.
Right. I believe I think Gary Peters, our senator, is involved with that. Is that correct?
Yeah, so we've met with Senator
Senator
Peters, and he's actually, both senators have met with our organization as a whole via virtually, and both of them have expressed publicly support for a price on carbon. Yeah.
Great. So I'm glad to hear you say that that CCL has had some successes, that there's work to do, but this has all been very interesting. I don't see any other questions. I do have one my own, which is about, are there any nations that are ahead of us in terms of movement on against the disastrous effects of climate change? Any role models out there? I realize each nation has its own circumstances of all kinds, but are there any that you would point to that we could learn from?
Yeah, I think the Scandinavian countries are really well ahead of us. Not surprisingly, Sweden, Denmark, many of them have gone much further in terms of developing the infrastructure for clean forms of energy. A lot of them, well, the EU has a price on carbon, and many of them have, some of them have cap and trade systems, which have not been as effective as carbon taxes, and the way they're designed have not been as great. But in terms of being ahead on climate in general, almost all the European countries are, and especially the Scandinavian ones. And then Canada. Canada has a price that essentially is a carbon fee and dividend system, and is working very effectively. So, and Canada is a little bit difficult in that it also receives a lot of its economic viability through the tar sands. So they have a huge struggle there in trying to decide, want to go ahead environmentally, but there's a strong pull, and heavy financial incentive to not. So life.
Right. It's not clear cut in some cases. Well, great. Well, thank you so much for your presentation and answering all these questions. I'd also like to thank our audience for tuning in today. We appreciate your attendance, and thanks to Matt Kern of Traverse Area Community Media, who is our technical expert. And Matt, at this point, has a brief announcement about an upcoming event that might interest any of you who are interested in webinars like this one. Matt?
Yeah, thanks, Ann. Hi, my name is Matt Kern, and I'm the station manager at Traverse Area Community Media. Thanks for joining this webinar today. I just wanted to mention that if you're interested in learning how to make a webinar like this one or host a community event on Zoom like this one, we have a training that's free tomorrow, and that's at 2 p.m., January 19th, 2022, so tomorrow afternoon. I just posted the link in the chat for how to register for that event. If you'd like to learn how, or if you'd like to sign up, then you can learn how to run Zoom, use all the tools in Zoom to host an event like this, how to advertise it. And we'll also, if you have an interest in hosting a community event and you're a community group, a citizen, or a nonprofit, you can have access to our Zoom webinar account that way as well. And if you check out our Facebook page, the Traverse Area Community Media Facebook page, we will have upcoming trainings on there as well. For instance, next week, we are going to be doing a training about how to start a podcast from home and how to record podcasts at home just using devices you may have around your house, like your phone and computers. And that training is also Wednesday at 2 p.m., but that's next Wednesday. So yeah, go ahead and check out our Facebook page and check out the link in the chat of this webinar if you're interested in either of those trainings. Thanks, Ann.
Great, thanks, Matt. We also just had someone who's watching this mention that she feels that Costa Rica is another example of a nation that has been effective with, or is doing a good job with. Okay, we have a thumbs up there from Lisa that Costa Rica would also go on the list of positive role models. Thank you. Now, as I mentioned at the beginning of this program, the League of Women Voters, which is a national organization, does have a position that supports the type of work that Elisa has been talking about, and the National League has a concern, as we all do, not just for the health of individuals, but for the health of the planet. So if you're interested in learning more about the League at a local or state or national level, you can go to the League of Women Voters Grand Traverse Area website, which is lwvgta.org, and learn a little bit about the League there. Before we end today, I'd like to announce that in February, we will delve into a very different topic. It is what is included in a clerk's universe, a conversation with the city and county clerks in Grand Traverse County. We'll have Bonnie Sheely, who is the Grand Traverse County Clerk, and Benjamin Marentet, the Traverse City Clerk. And they will discuss what clerks' responsibilities are beyond the elections. The program will be virtual like this one, and it will be aired from noon to 1:30 on February 15th. Then on March 15th, a month later, our program will be an update on the post-census county and state redistricting process in Michigan, which, as many of you know, is brand new to us this year based on new laws that citizens passed in 2018, I believe. So those are two programs coming up. We hope you'll join us. And I want to thank you again for being with us here today. Tell your friends that this program is available for viewing after the fact on the Traverse Area Community Media Facebook page and the League of Women Voters Grand Traverse Area Facebook page. And for a while, it may also be viewed on Spectrum channel, cable channel 189 in Northwest Lower Michigan. Thanks again. Bye now.